Bismillahirrahmanirrahim. Assalamu alaikum. My name is Fiz Ahmed. I'm student of BTS first year. So today my topic is the adrenal gland, and first I will start with the hypothalamus. Basically, the hypothalamus, which is the higher center of the brain, is the main regulator of the adrenal gland, and this is the kidney, and above the kidney sits the adrenal gland, and here is the cross section of the adrenal gland. The outer portion of the adrenal gland is known as the adrenal cortex, and the inner portion is known as the adrenal medulla. And we can recognize the three layers of adrenal cortex by this mnemonic GFR of the kidney. The first layer is the zona glomerulosa, the second one is the zona fasciculata, and the third one is the zona reticularis. And the hormone of the adrenal medulla are epinephrine and the norepinephrine. So there are two cases in which the role of adrenal gland is important in management of these two conditions. The first one is the condition of the acute stress, and the second one is the long-term stress, management of the long-term stress. So first I will explain the management of the acute stress. When the stress signal appear on the higher center of the brain, then the stress signal move down the spinal cord, and the sympathetic nerve will move out from the spinal cord, and these sympathetic nerve will act on the adrenal medulla and stimulate the adrenal medulla to produce the epinephrine and norepinephrine in the blood, and the increasing level of these two hormones in the blood will trigger the fight or flight response to in management of the acute stress. And now I will explain the role of these three layers one by one in the regulation of different systems within our body. And the one thing which is important that the hormone of the zona fasciculata layer, which is the glucocorticoid, is the cortisol. It helps to impart the negative feedback effect on the hypothalamus, and the use of this negative feedback effect of hypothalamus on hypothalamus is to reduce the secretion of corticotrophic releasing factor uh, to stop this whole cascade within our body. Now I will explain the uses and the role of these three layers of the adrenal cortex one by one. So let's go. So here are these three layers of the adrenal cortex. The first one is the zona glomerulosa, and I will first explain the hormone aldosterone of this layer. Uh, Here is the functional unit of the kidney, which is the nephron, and the function of the nephron is the filtration of the blood and the water within our body. So when there will be the decreased blood pressure, the role of the aldosterone is basically to increase the blood pressure in maintaining the blood pressure of our body. The question is how this will happen. The aldosterone will act on the nephron and help in the reabsorption of the water and the sodium ions from the tubules into the blood, and the secretion of the potassium ion from blood into the tubules, and then it will act on the distal convoluted tubule, and this aldosterone will stimulate the sodium ions and H2O retention within our blood to increase the blood pressure. So main role is in the maintaining of the blood pressure. The second most important thing, which is the most important, is the renin angiotensin aldosterone system. Now I will explain what is this system. Here I will again consider the functional unit of the kidney, which is the nephron, and these are two arterioles of the nephron, the afferent arterioles from which where the filtrate will enter the head of the nephron, and the efferent arteriole from where the filtrate will leave the nephron. When there is a decreased blood pressure, then the filtration rate will be low, and the pressure in the afferent arteriole will also low. So these two factors will stimulate the juxtaglomerular cells of the nephron to secrete the renin, and this renin will start the renin angiotensin aldosterone system, and this system will produce the final important product, which is the angiotensin 2, and this angiotensin 2 will act on the aldosterone, and this hormone will act on the nephron in the same way as I explained you just a 1 minute ago. So this layer of the adrenal cortex help in the maintaining of the blood pressure. Now come to the zona fasciculata. The main hormone of the zona fasciculata is the cortisol, which is the glucocorticoid, and there are total four effects which are imparted by the cortisol. The first one is the hyperglycemia. The cortisol increase the glycogen level within the liver, and increase the glycogen synthesis, and it also increases the rate of the gluconeogenesis, and also increases the fat deposition. And the main effect of the cortisol is to increase the insulin resistance of the glucose. By all these effects, the glucose taking ability of the cell will be decreased, and the level of the glucose within the blood will be increased, leading to hyperglycemia. The second effect is that it will increase the blood pressure. Then the third effect is the suppress. It will suppress the immune system. By this effect, the pain sensation within our body will be decreased, but the exposures and the possibilities of the infection will be greater. And the final and most important effect is that it will increase the osteoclastic activity, by which the osteopenia will occur, and the more frequent fractures will be occur. And the third layer is the zona reticularis, and the important hormone of this layer is the androgens, and this hormone is not involved in the stress stimulation or the blood pressure regulation. It is the hormone which is present in the sex hormones, and it play important role in the prostate growth in male, like the heaviness of the voice, and the masculine characteristics of in the female. So here we are done with the adrenal gland and the regulation of the different hormones of the adrenal gland. Thank you so much.